what did I get to do today? I got to take out someone's Foley, gave a shot of insulin, dealt with some nasty looking cellulitis. When you're in clinicals, you don't need to be nervous about taking care of the patient. You're not responsible for the patient. Oh, you guys, I got the hot car sauna going on. I like that feeling. I'd always rather be too hot than too cold, but it wasn't hot or cold up on that floor. I gotta say, they keep the temperature pretty comfy there. But if anything, I would have leaned towards it being too cold. It feels nice in this car. Like a dry sauna, but kind of nice. Today was my last day with one of the nurses I've worked with a lot of shifts. I'm gonna miss her. She's great. I just found out she's working on her master's for nursing education, which is cool. She would make a great teacher. She's awesome. So let's see, what did I get to do today? I got to take out someone's Foley, which is so much easier than putting it in. I've taken Foleys out of 2 guys, not put a Foley in a guy yet. I'm nervous to do that, just because if I was a guy, I really wouldn't want it done. So that's why I'm nervous about it. But got to take one out. That's way easier. Gave a shot of insulin, checked blood sugar like 5 bazillion times on this one lady who kept reading really high numbers. So high it wouldn't read it sometimes. It would just say over 500. What else did I get to do today? Help dress a wound. Dealt with some nasty looking cellulitis. I've seen weepier. I had a friend that had way worse cellulitis as far as weepy looking, but the color on this was just bad. It was a really just reddish purple dark color. I don't know. I read like Venus Doppler results and her veins were flowing pretty well, but her circulation just looked awful by the color, especially of her toes. But she was really good at explaining things to me the way she'd understood it, and it was her smaller capillaries closer to the skin that were having problems more than her bigger veins and arteries, which I still don't understand then, like that's how they connect to each other, but interesting. Okay, but right now I'm in McDonald's and I don't think I can record and order an iced coffee at the same time, so gotta stop this. Once I found the McDonald's app, which I don't know, that's been maybe a year ago now, I became a McDonald's addict. Some of it is because I can always get a large iced coffee for $1. Sometimes I go all out and pay 25 cents extra for caramel drizzle added. I usually get a large caramel iced coffee, but if you add extra caramel drizzle, the drizzle, they'll make it a little different. If they do it right, it's just like drizzled in there and you get little bits of caramel sometimes as you take a drink. But $1 for a large iced coffee, you can't beat that. So I'm here way too often. The good news is my kids don't like McDonald's because I've taken them here too much. So I think that's a mom win. If your kids don't like McDonald's, that's a mom win. But yeah, finished 9 hours, get in my coffee, which I already drank 1 huge iced coffee today. But I need to have energy when I get home to help Chris, because he's really been, I scratch my nose a lot, don't I? It's allergies stuff. But anyways, he's been busy today. He's been doing a ton. He did a ton yesterday on Father's Day, because Sundays is church. And church are busy days. Church days are busy days for him. So yeah, I need to get energy and have energy when I get home. I need to do schoolwork, get my kids' attention. Here they come with my coffee. Hooray. Hi. Thank you so much. Have a good day. They did it the right way. That's the drizzle. That's definitely worth the extra 25 cents. Now I make iced coffee in the morning to take with me. And I can tell you right now, mine is healthier than this because this is way sweeter. And I taste the caramel drizzle. Mine is just heavy whipping cream, a hot cocoa packet, and a bunch of instant coffee. I don't think I'm too picky with my coffee. It's good, but it's not super sweet. One hot cocoa packet for like, you know, this amount of coffee, but sweet enough. But this has got to be way less healthy. This tastes more like caramel milk and less like coffee, even though mine's instant coffee and this one's probably not instant coffee. But yeah, I don't have anything else to say, I guess, about clinicals today. Took out a Foley, gave someone insulin, took blood sugar. Oh, I hung a lot of IV meds, flushed the IV port, helped do intake questions for someone, some medication reconciliation. That's where you make sure the medications you have listed match up with what the patient says they take and are taking at home, and it's the same amounts. And that's always fun with people who have a whole lot of medications and maybe aren't taking everything that's prescribed to them. Like, oh, I take this, I don't take this one, it's too expensive. I don't take this one, I just haven't got this one yet. And it's like, or they say, well, I don't know which one is the little oval white pill. I think it takes a special level of expertise to get to that point. But sometimes you have to know, like, the color cap of the eye drops that they take might help you with the medication reconciliation if they take two different kinds of eye drops, or the color tablet, the size of the tablet, stuff like that. I had a patient with seizures today, but she didn't have any while she was there. That was kind of just interesting because that's the first patient I've dealt with seizures, and didn't really make me nervous. It sounded like they were pretty regular, but would stop on their own within 2 to 3 minutes, normally at home. Plus they were already prescribing to give her Ativan if she had a seizure, so it wasn't like, what would happen? Well, plus I'm just a nursing student, so I don't get nervous about stuff because I'm not really responsible for it. When you're in clinicals, you don't need to be nervous about taking care of the patient. You're not responsible for the patient. That's someone else. You're their helper, their shadow. You know, you're doing things you're confident. I don't want to say that you're confident you can do already because you're learning them, but you're only doing things if you feel comfortable doing them. And the nurse is right there with you to help you so you don't mess it up. So, like, I'm not 100% comfortable putting in a Foley cath on a female. Even though I have straight cath Raylan, Foley caths are a little more complicated, and anatomy is just a little different on a grown woman compared to Raylan. So I can't say I'm 100% comfortable with it, but I know it's okay. Like, a nurse is right there that is comfortable with it. I know I'm not gonna like hurt them. Not that it's not a little painful, but I'm not gonna do any damage to them. I understand the procedure, stuff like that. But like, if I was the nurse, not the nursing student, something, you know, you can be a little more nervous because you don't have someone right there to answer all your questions. So I don't get nervous as a clinical student because there's always someone there, right there to answer all my questions. They're the ones responsible. I just get to do the stuff with them right there to help me. So, I mean, I don't know, maybe it would be different and I would have been more nervous if I was the nurse responsible for her seizures, but it just didn't seem like they were that big of a deal. But they were trying to get her out of our little bitty hospital to a different hospital that had a neurologist there all the time because of that. So, once again, Pana Hospital doesn't deal with complex stuff because they didn't want to keep her at Pana since her seizures weren't under control. They wanted her to go somewhere that had a neurologist all the time. Dealt with some medication compliance stuff today, like someone not really wanting to work with the OT, not wanting to take a PRN med that would help with some anxiety and pain, and then also not wanting to go get the procedure done because of the pain, and actually in their chart also. They refused to be admitted before they agreed to be admitted. So I got to see some of that, some of the, I don't know. I'm going to have to come up with what nursing diagnosis to give that, because that was my main patient today that I'm going to write on. She was kind of, I don't know what the nursing diagnosis is. I'm sure there's some sort of compliance nursing diagnosis about education for medication compliance or education for care compliance. And I kind of wonder how compliant she was being with her medications at home, because they weren't working at all at home. And it's like, maybe they weren't working because, you know, I just want to follow the directions. But she was a nice lady. I really liked her. I learned a lot from her. I mean, she taught me a lot. She was explaining some of her history of stuff and some of the past surgeries she dealt with and things she learned, and it was she was a good patient to have. I enjoyed having her. I enjoyed learning from her. I don't know why she wasn't compliant on all the stuff. They had a lot of patients. That's 7. I bet some of you are laughing. That's not a lot, but that's the most I've ever seen on that floor. That's 7 at one time. 3 went home, but then went home or transferred to different places. But then another 1 was admitted. Yeah, it's kind of busy day there. But I'm rambling. I don't have anything else to do. I'm gonna drink my coffee. I'm gonna get home. All right, guys. Thanks for listening to me ramble.